share with each of you today. I'm joined as we are each week with Pam, who's our sign language expert for the deaf and hard of hearing. Pam, thanks for being with us as well today. Also joined you, although you can't see them on your screen yet until they're part in the presentation, we have Dr. Carol Rattay, who's with us most weeks, the Director of the Division of Public Health, Director AJ Shaw from DEMA, who has been the point person for our testing program, our vaccination program, and doing a tremendous job with his team, in partnership with our friends and colleagues at FEMA and their work. And of course, the men and women of Delaware's Army and Air National Guard. General Mike Berry, the Adjutant General of the Guard, is with us today to talk about the Guard and its incredible role in these efforts. And you'll see for yourselves as General Berry reports on the activities of the Guard that they've been with us every step of the way. They've been incredible, frankly. I want to shout out to Staff Sergeant Martin, who was at the DMV in Delaware City on Sunday. I approached her team. I was told by the public health officials there, complimenting Staff Sergeant Martin and her team, and saying that if we could only clone Staff Sergeant Martin, we certainly would, and make her and the rest of her team part of the public health outreach. Is just an indication of the importance of our citizen soldiers at the Delaware Army and Air National Guard. We thank them for their dedication, for their commitment to our country and our state, their dual mission. And we have General Berry here with us. Thank him for his leadership and his leadership team. As I said, we have lots of good news this morning. As your governor, I feel like we're turning the corner. That light at the end of the tunnel is getting brighter every day. We have some good indicators on the health of our community. You'll remember that we have the dual goals of a healthy community and a strong economy, and we've been trying to strike that right balance from the beginning. You will see that we are getting healthier. We have fewer cases on a 7-day moving average than we have had in a long time, moving towards a 200. We have fewer than 100 hospitalizations. We'll see that in a minute as well. We'll take you through that data. We continue to test at rates far beyond what we expected, what we thought was our reach objective back in the spring of 80,000 a month, almost twice that number. AJ and his team, our colleagues, Delaware Army and Air National Guard, and the others that have been an important part of that. We've been vaccinating at rates that mirror the allocation of supply that we're getting from the federal government. You'll see, and you've been hearing me say for weeks now, that we'll be able to push out into people's arms the supply that we're getting from the federal government. We had a little bit of a delay, a little bump in the road with the weather a couple weeks ago, and so we've got a little bit more supply on hand than we normally would expect, and that's a good thing, as we'll be able to move those out and get them into people's arms. We've been doing a really good job of finishing up our 1A populations, first responders, law enforcement, healthcare workers, making it opportunities for them to get their second dose, fulfilling those in partnership with our friends at FEMA at the Dover Speedway, and that's really a big asset for us as we move forward. We have the arrival of the Johnson & Johnson single-dose vaccine. Really good news. You've heard me talk about it. It's a real game changer. So over the weekend, we did nearly 2,000 Johnson & Johnson vaccines at Seaford High School in the lower part of our state, and almost 3,000 Johnson & Johnson single-dose full vaccinations at the Delaware City DMV. Really smooth operations on both cases. We're able to do seniors and work off our registration list. We've been making steady progress. I think over 70,000 folks have been worked off the registration list, which was well over 100,000 at its peak. We are getting from the federal government, as I've mentioned before, separate allocations to our state, to certain Walgreens pharmacies. initially for the purpose of achieving some of our equity goals. We'll talk about that a little bit later. But the President of the United States, President Biden, our own former United States Senator, has challenged all the states to finish off vaccinating our educators, school personnel. And so we're going to really lean into that effort as we have been. We have about a third of our educators who want and need to get vaccinated, about 5,500 vaccinated. And so we intend to do the other 2/3 really quickly over the next couple weeks so that by the end of the month, we will meet the president's objective of getting educators fully vaccinated in our state. As I said, we are getting a separate allocation directly from the federal government to those certain Walgreens pharmacies. And so there'll be appointments available at the Walgreens pharmacies, as well as opportunities to get vaccinated through our State of Delaware DPH pods as well. We're starting to move into vaccinating essential workers in the 1B. We've announced and moved out vaccines to the frontline poultry plant workers who frankly have seen the worst back in the spring in terms of the spread of the virus early on, working with many other 1B essential worker populations to make sure that they can get vaccinated and continue to do that work. One of our major focuses and biggest challenges, frankly, is getting an equitable distribution of the vaccine across our state. You've heard me say before that our goal is simple, fast, and fair. Move as quickly as possible the supply and allocation of vaccines we get from the federal government as equitably as we can into populations across our state. Has been difficult for our senior population, that 1B, 65 and older population, limited mobility in many cases, limited access to technology and expertise with technology. Most of them have to be helped by adult children. And I've seen just some really heartwarming examples of adult children supporting and helping their elderly parents and relatives. And so there are many opportunities to get vaccinated in our communities of color across our state. We've got a list of those later in the presentation. And those are efforts to get an equitable distribution and a fair distribution across our state. It's something that we'll continue to focus on. We rely pretty heavily on community organizations and others to move the vaccine. Lisa Henry and her team at the Division of Public Health really doing an excellent job partnering up large healthcare organizations like our hospitals and other providers with community organizations and faith communities to move vaccines out into diverse populations. I do have concern about a number and a pretty big significant percentage of our state, people in our state who are hesitant to get vaccinated. Concerns maybe about the speed with which the vaccines were approved in the first place, concerned maybe with some of the science, concerned about whether it might keep them from work. I would encourage you to talk to your friends, neighbors, family members who have been vaccinated. It's incredible as I go to these clinics to see how just over the moon excited people are to get this life-saving vaccine. We have lots of information to share with you to encourage you to do so. But the best thing you can do is just talk to your friends, family members, and others who have been vaccinated. And then to think about the difference that it can make in your life. Dr. Rattay is going to talk a little bit about the CDC guidance that indicates the kinds of things that you can do with your family members and loved ones safely if you or your family member is vaccinated, and which I think will provide some incentive to go and get vaccinated yourself. So with those highlights, why don't we move through the presentation? Here's our data. I mentioned hospitalizations, that one measure that we look at very carefully, under 100 for the first time in a long time. Really excited about that. Closing in on 200 cases per day, new cases per day on a 7-day moving average. And then of course the percent positive under 5%, which is the that World Health Organization goal. Sadly, of course, we still have more people who succumb and die from COVID-19. Most of them are our very senior citizens and significant percentage of the people. Looking again at our testing totals on the next slide, we're moving up and just doing an incredible job. Almost 1.5 million total tests that have been administered in our state. Again, thanks go out to our partners with Curative, with the Army and Air National Guard, with the public health teams, with everybody who's really pitched in, and with AJ and his team, and AJ's running point on there. With respect to the vaccination update, I talk about the overall doses administered, 280,000. They include people who are fully vaccinated, which could be someone who received a Pfizer vaccine and a Moderna vaccine, a first dose and a second dose before they're fully vaccinated, and then someone who would get a Johnson & Johnson one dose only. This is the total number of doses that have been administered. You can see we've had over 300,000 delivered, so we have some that are in the pipeline ready to be moved out for the big clinics that I've been talking about, and you'll hear more about from AJ. And then there's the federal pharmacy program. There are 61,000 that go directly to the pharmacies initially for nursing home vaccinations, and then more recently for equity objectives, and then more recently with the President of the United States directive to have all those doses go to our educators and our those educating, teaching our children. Next slide is the graph that shows number of positive cases. You can still see the young adult population, 18 to 34 and 35 to 49, with the highest number and highest percentage of those cases still leading the way, and ask everybody to be cognizant of protective and mitigation measures. Next chart is our hospitalizations. Again, as I said, finally below 100 for the first time in a long time, since back in probably late October, since the Halloween, Thanksgiving surge that we saw. We peaked out at 474 hospitalizations, and even at that level, we still had some headroom to enable a space for patients that might need hospitalizations. We've been through how the hospitals manage that surge, and we appreciate all their work in managing the folks in their facilities. So we hope to continue to move this number down as we get healthier. As I mentioned before, we really are with the challenge of the President of the United States focusing on vaccinating educators and child care providers. We have large vaccination events coming up this weekend, March 13th and March 14th, Saturday and Sunday at the Dover International Speedway. And we will be trying to do 4,000 doses each day, 8,000 over the weekend to try to finish up, really finish up the vaccination of educators across our state. So there must have an appointment. There's a way to get signed up for that appointment, and we encourage all of our educators to do so. They can also make an appointment at their Walgreens pharmacy in their neighborhood and encourage them to do that as well. Those that are part of the federal vaccination program have been directed by the federal government to prioritize educators between now and the end of the month. Here we go with, again, the vaccinating educators and child care providers. I mentioned in line with the federal guidelines, Walgreens is going to be prioritizing those. Here's just some photographs from the vaccination clinic there at the Delaware City DMV. Johnson & Johnson one dose just had tremendous support from Del.gov. You got hats off to Secretary Majeski and her employees at Del.gov for the way they managed the flow of the cars through the DMV there. The longest wait was about 30 minutes or so coming in. And then of course, 15 minutes to 30 minutes for observation after getting the vaccine shot in the arm. We appreciate the volunteers from the Medical Reserve Corps volunteers that were there, from our employees at the Division of Public Health, Delaware employees, the Delaware Army and Air National Guard, everybody that pitched in. And my final message before we turn it over to Dr. Rattay is a simple one, and that is when it's your turn, please get vaccinated with whatever vaccine is available, regardless of the type, equally effective in preventing death and hospitalization, serious illness, just a slight difference there. And with the J&J vaccine, just one single dose, which logistically is a lot easier for most of us. So when it's your turn, get vaccinated. We hope, and we'll talk a little bit more about getting into essential workers and teaming up with their employers. I mentioned the poultry plant workers, which have received some vaccines this week. A lot of the folks that are in that food supply chain, from the delivery and manufacturing of the food to its sale in grocery stores are areas of focus, as are our educators, as we've said. So with that, I want to turn it over to Dr. Carol Rattay. Thank her and her staff at the Division of Public Health for their tremendous work, for their vigilance, and for bringing us to this happy day with so much good news. Dr. Rattay.
Thank you so much, Governor. And yeah, we do have some good news to share for sure. So let's talk about our case rates. As the governor said, things are slowly improving in our state, and this map looks a lot different than it did a few weeks ago, for sure. In fact, as we've mentioned the last few times, we've decreased the criteria for areas of concerns to where we were in the fall. And this week, we only have 4 zip codes which meet that criteria of area of concern. 3 of them are surrounding the UD community. All those zip codes are seeing some improvement. So we're really happy to see improvement. Really want to give a shout out to UD for aggressively testing many students in the last few weeks, as well as putting a lot of mitigation strategies in place. So although it remains, one of our hottest spots in the state, and in the last month, we have seen now almost 500 cases in that area. We're happy to see so much testing and numbers of cases going down slightly. Townsend is the other area that's ticked up a little bit. Not quite sure why, but for those in that area, want you to be aware that there seem to be a little bit more cases in the Townsend area right now. But overall, this map is a piece of good news for sure. On our vaccine front, we're also seeing some good news. We now have 280,043 doses administered in our state. So we continue to increase our ability to vaccinate. And special good news on the next slide is guidance that was just released from the CDC yesterday. We've been awaiting this guidance. They've really been looking at the studies of what fully vaccinated means as far as protecting an individual, not only from getting COVID, but also from spreading COVID. And, we'll make a note that being fully vaccinated, which means you've either had your second dose of Pfizer or of Moderna, or your single dose of Johnson & Johnson plus 2 weeks. So you got to wait 2 weeks after those doses, you can be considered fully vaccinated. That doesn't mean you can't get get COVID, but as we've talked about, it almost completely eliminates the most serious consequences. And the science is also beginning to show you're less likely to be able to carry and spread the vaccine. Given that, some good news is those considered fully vaccinated can now visit with others who are fully vaccinated. with no mask and no social distancing. So that might be a group of 4 or 6 friends who might want to play cards or have some kind of special gathering like that. If everybody's fully vaccinated, that's fine. Additionally, if you are vaccinated, fully vaccinated, you could spend time with a single household of individuals who may not be vaccinated, but who are at lower risk, meaning none of the chronic underlying conditions or not over age 65. So that's good news for grandparents who want to visit their grandchildren and their children. Again, though, we ask to be just with a single household. And additionally, and this is a little bit of an update, if you've been fully vaccinated and you've been exposed, you no longer have to quarantine, even past 90 days, and you don't have to get tested after a known exposure. So that's all really great news. We do, though, want to make sure people know that there's still caution that we have to have in place, because there is a possibility you could carry or spread. You do need to wear a mask and social distance in public. You need to mask and distance with those who are at higher risk, like I mentioned. Mask or social distance with when you're in the setting of multiple households, and avoid gatherings. Settings where there's 25 or more people in one setting. Also, if you are traveling, you're still going to need to be, like if you're on mass transit, you want to make sure that you continue to mask, like on a bus or a plane, and follow your employer guidance. This guidance does not apply to health settings or congregate settings. It's really just small social settings where the individuals that you are spending time with. But again, we're super excited about this.
Dr. Rattay, if I could just interrupt there to tell you how super excited I am about this, as I talk often about my mother, who's 89. She'll turn 90 years old March the 21st, and I go to visit her as many of my brothers and sisters do as well. We bring dinner over, but generally we bring dinner for her. She'll eat by herself, and we might sit there with her with our masks on. But these changes, she's now been fully vaccinated, and this will provide me with an opportunity to go over there and actually share dinner with my mother as I bring it to her, and it just makes a huge difference. And for those of you who need an incentive or a reason to get vaccinated, if you're a little bit hesitant, I can't think of a better reason than that, to be able to have more social interaction with the people that we love. So Dr. Rattay, really good news.
Yeah, it is really, really great news. So let's talk a little bit more about the doses that have been administered in our state. We have 170 individuals in Delaware who've been partially vaccinated. That means they've received 1 dose of the 2-dose vaccine, and 104 fully vaccinated. Now we know that number is going up. The Johnson & Johnson from this past weekend is going to push that number up a bit, but we're about 10% now of our population that's fully vaccinated, which is really exciting. And soon we will be presenting this data on our dashboard. So stay tuned for that. As it relates to our seniors, we have 106,000 of our seniors who've received at least 1 dose. 63,000 of seniors who have received 1 dose. I'm so sorry. Let me start this one over, please. 106,000 seniors and 63,000 non-seniors. So that would be healthcare workers or others in the 1B category, like educators. Knew that wasn't making sense. 106,000 seniors who have received at least 1 dose. However, when we look at our waiting list, which is 133,000, we have, at this point, we know of 71,000 who have received their first dose. And so we still have an important need to get invitations, to get vaccine opportunities for those who have been patiently waiting on our wait list. We know that you're there. We know that you're getting tired of waiting on the wait list, and we know that we have individuals who are, in their 70s still on the waiting list. And so, again, this is the time now for us to really push and get vaccination opportunities for those of you who are on the wait list, to get you some opportunities to get vaccinated. And we're going to really push hard for that over the next couple of weeks. So this week, we are doing first doses for 4,400 individuals in curative, and the invitation for this was sent out to those on the waiting list. I think AJ is going to talk a little bit about how this invitation was spread widely, and that is not what we would like to see. But the goal really was to get about 4,400 people off the wait list. As the governor said, we're also really excited and hoping to make significant progress in getting a lot of school staff and childcare staff vaccinated this week. But we're also doing a lot of our community and equity events, which I'll talk more about. Additionally, on the next slide, I want to talk about some of the other partners who are getting vaccinations. So this week, 14,000 doses has gone or is going to hospitals. We have over 10,000 going to healthcare providers and other healthcare providers in urgent care. A lot is going to pharmacies. So the federal pharmacy program provides vaccine for Walgreens, who has received over 15,000 doses in the past week. And we have been trying to get vaccine to some of our other partners, Walmart being one who's really starting to pick up speed, as well as a number of independent pharmacies in the state. So a lot of vaccine is going out there to our partners right now, which we are very excited about. So the governor has talked about the importance of vaccinating fair and fast. And on the fair side of things, we are pleased to say that our efforts by Community Health Services to go into neighborhoods and work on smaller events targeting underserved communities has led to vaccination of over 2,200 people so far. And on the next slide, I want to show you just some of the events this week. So we are ramping up our efforts ourselves and with a number of partners to have over 20 events this coming week, again, to really meet members of the community where they are. So we're excited about being able to make progress. We know we still have a lot of work to do, but we feel like we're on the right path there. Let me talk about some more exciting news, which is our moving forward on vaccinating more members of the 1B workforce. So we have been getting more first responders, law enforcement firefighters who haven't been previously vaccinated. Vaccination. We've been working on correctional officers. We're more than halfway done there. As we've talked about teachers, school staff, and childcare providers. And we just got started with poultry last week, which we're excited about. And today, we can say that we have begun to contact a number of other partners that we've already been working with for months to tell them it's now your time in the next week or so. One thing I really want to emphasize is for all these groups, we're really focusing on frontline workers. We're really focusing on people who either can't social distance with each other. So poultry is a good example where people work closely together or are interacting with the public. Again, can't social distance in their interactions with the public. So food manufacturing, there's about 13 or 14 facilities that we are working with to get started around food manufacturing. Under agriculture, We're very grateful that Westside Health is working with migrant farm workers, which soon we'll see more. But additionally, there's some other partners in agriculture who have difficulty social distancing and interact with the public. So we're working with Department of Agriculture there. Grocery stores are in the last year, those who work in grocery stores, you think about the checkout clerks, they have interacted with so many members of the public all day, every day that they are working, putting themselves at risk. And we are really excited to get started with the vaccination of frontline grocery store workers this week and next. Public transit bus drivers, Amtrak workers, postal service, again, those who are interacting either with the public or closely with each other. We're going to get started with those groups very soon. Higher education is a big one. Lots of people working in higher education. There are a number of folks in higher education, colleges, universities, who are doing face-to-face learning or who work on site, on campuses right now, either with difficulty social distancing, interacting with the public, interacting with students, like food service would be an example where they're interacting with students. So it is not all individuals in higher education who are in 1B, but those who are at higher risk, especially those teaching in person, will soon have an opportunity for vaccination. Additionally, there's folks in other manufacturing of critical supplies to fight COVID, like PPE and pharmaceutical, who are also going to be able to receive vaccines soon. So again, we're really, really excited to move forward on that. And on the next slide, I just wanted to show you, how we are ramping up our efforts. So you can see that line when you go from the 24th of February on, we really are ramping up our ability to vaccinate more people on a daily basis. When you look there at March 4th, we got about 7,000 individuals vaccinated in those days. And last week, we vaccinated over 50,000 individuals in Delaware. So we are ramping up our ability to vaccinate through many partners, which is important. And we're going to keep ramping up to meet the demand. But it's very exciting that we are getting more vaccine here in the state. Finally, I just want to make a comment. We want to use all of our vaccine capacity to its maximum. And so for those who make appointments at vaccine events, we've been seeing more people not showing up lately, and we just want to remind you that when you don't show up for a vaccination event, and maybe you've been vaccinated elsewhere, but please do keep in mind that you are taking a spot away from somebody else for a capacity for an event, for an activity that was, really set up to vaccinate a certain amount of people. So please do your best to fulfill vaccine appointments when you have made them, or make sure you get it canceled so that somebody else can take that spot. And with that, I'm going to hand it back to Governor Carney.
Thank you very much, Dr. Tay. Some really good news there. You can see 280,000 doses total. Some of those were first doses just recently. The arrival of Johnson & Johnson one-dose vaccine, that's a big deal. We've gone just in the last month, if you look at the chart there, vaccine capacity, we've doubled our throughput in the last month from about 3,500 per day on a 7-day moving average to 7,000 per day. As I said before, our objective is fast and fair, and that we would move as quickly as possible the allocation that we're receiving from the federal government as fast and as fair as we possibly can. We've also said that we will meet the allocation we're getting, and that's what we're doing. We have a little bit of a backlog right now because of the one weather week where we missed deliveries, but we've got the capacity to move those vaccines out as well. You can see all the areas of focus with essential worker groups, each of which very eager to get vaccinated. We're making great progress through our educators, teachers, childcare workers, and we expect and hope to finish them off by the end of the month. So really good news there in terms of the vaccination front. At the point there is AJ's got a big team. AJ Shaw, take it away.
All right, sir. Good afternoon, everybody. Going to kind of start off where Dr. Ortega was talking about the reservations for appointments and us using partners. So this week, I think we already reviewed, Curative is going to be doing appointments for approximately 4,500 people over the age of 65. We sent those invitations out to people that registered with the state and prioritized them by age and by some other factors as we go to invite them. And then this weekend, we had some of those links really shared across email, group, social media, et cetera. We had people that were under the age of 65 that showed up that we had to cancel. And all that does is cause a snowball effect for those over the age of 65, the highest risk individuals we're trying to protect at this time. So all we ask is that you honor the way the directions and reservations are sent. We are trying to get as many people as quickly and, as the governor said, as fast and fair as possible. So, there was some information that was put on one of the posts that said it was for, people under the age of 65 and under work groups. It wasn't true. We had it right up there in the header. So please, I know we're all excited. I know there's some emotion. I know there's, just people wanting to get through this. And we just want to make sure we follow the systematic process that the, Division of Public Health and the CDC and our other partners have written and approved. So thank you in advance for your cooperation with that. Talk a little bit about testing before I turn it over to General Barry, who's really been doing a lot of the heavy lift with a lot of things, as you'll see, but most definitely testing since the weekend before Memorial Day. And we are continuing to have strong participation. We have seen numbers decrease slightly. We were up in the 40,000 range, 50,000 range around the holidays, down now in the mid 30s. So still strong because we still have capacity to test more people, which goes into our next slide. And thank you for the teams, the communications teams that have worked on this. There's a lot of data out there. There's a lot of testing options. We did new testing flyers, kind of a little bit more of a line item approach that shows you location, times and what process to sign up as well. And it's switched between, the fixed scheduled events and then the pop-up events. So just because people are getting vaccinated doesn't mean that the risk has gone away. So we want to make sure those individuals that are in settings where they have higher risk, please get tested. We have ample opportunities across the state and we'll continue to do so. So de.gov/get tested is where you can find all that information in those sheets. And with that, I'll turn it back over to the governor, the general.
Thank you very much, AJ. Thanks for all the efforts on the testing front, all the efforts on the vaccination front, clarifying the registration process, which really is a critical step here that needs to be followed. It enables us to target populations by priority, a priority that was objectively determined by the federal ethics panel, sifted through by our local Delaware ethics panel and prioritized in such a way that identifies the folks most at risk. And that's why we're really focusing now on those friends and neighbors, family members 65 and older. We still have to get through those. And if somebody jumps in line, it's going to prevent a vaccine from going to one of those senior citizens. We also know that, and be mindful of the fact that the vaccination supply is increasing. The federal government is moving higher allocations. They're moving allocations directly to pharmacies. We're going to see more and more availability at pharmacies, I can assure you, over the weeks ahead, and the ability to move out more vaccines and hopefully moving into places like Walmart, which to date have not been doing much vaccinations, and lots of opportunities there. So be mindful of that. Along the way, we couldn't do any of this without the tremendous support and dedication of our Army and Air National Guard. Major General Mike Berry has been doing a tremendous job in leadership capacity. I know he's got a great team out there. I see his men and women at these vaccination sites, at testing sites, distributing food. They've got guardsmen and women that have multi-language capability, been extraordinarily helpful. General Berry, thanks for your leadership and thanks for the work of the men and women of the Delaware Army and Air National Guard.
Well, thank you, Governor, and thanks for the opportunity. Good afternoon, everyone. It's certainly an honor for me to be able to represent the 2,700 men and women that are part of your National Guard here in Delaware. Before I go through my slides, I would like to take the opportunity to put out a very sincere thank you to the families of our Guardsmen and to the employers, because it has been a very busy year, as you can imagine. And without the support of the families at home and the employers, our Guardsmen wouldn't be able to do what they do and bring the services back to our citizens here in Delaware. So let's go into the first slide. This talk a little bit about some of the efforts that we've been doing really since March of last year, as AJ said and the governor said, primarily under the topic of vaccination support. We've been working directly, we are a support agency, so we've been working directly for DPH and DEMA, working with vaccination centers, teams that are going out, as Dr. Rattay said, and targeting some of the populations that are a little bit harder to get to, may not be able to get out to some of the sites to get their vaccines. Tremendous, a lot of work that's required in working on the records, answering questions. So the record center, the call center, this is where a lot of our Guardsmen are able to come in and support the other agencies. And then of course the vaccination preparation and the transport. Once we've got to get the vaccines out there and get them distributed. So we've certainly been able to help with that. And then next slide with testing, we jumped into this really early on, and we've been really busy with that. The tests we're running ourselves in some locations. We're assisting Curative by moving around the trailers and manning the sites so that our citizens are able to get in and out relatively quickly with their vehicles and so forth. And it's been really good to see citizens serving citizens. And then again, just like with the vaccines, the electronic documentation of these testing is a big part, and our soldiers and airmen have the skill sets to support that. And continuing with the testing, the packaging, it's really a lot of work that goes on behind the scenes. And we've also got the capability within our civil support team to not only conduct testing, but to run the tests themselves in our mobile laboratory, which then helps take some of the onus off of the labs that we're running the tests or the sample kits over to. So we've really been able to mobilize our team and do some of the stuff that they're really experienced in. The next slide, you'll see some photos. We helped set up an alternative care facility within Newcastle County. Fortunately, we didn't need it. The governor mentioned earlier about the reduction in hospitalizations, and we're so fortunate to be in the situation we are in right now. But it was close, and if we needed to operate and bring patients in, we would have been prepared. We're also continue working in the warehouse, the national strategic stockpile, and assisting moving products around the state. And finally, we actually had our medical teams working in the Delaware Psychiatric Center and at BB Hospital, and helping relieve some of the burden that was as a result of the increased hospitalizations. Back in March, one of the first things we did on the next slide, you'll see we really had to get involved in the distribution of food, and we partnered with Food Bank and assisted Food Bank. They ran the missions, and many of the other state agencies also assisted and came out to make sure that our citizens were able to get the proper nutrition that they needed. And then on the next slide, it carried over from the food bank distribution sites to door-to-door deliveries for seniors and for our students who were not in school last spring and were not able to receive the meals that they need in order to maintain a healthy nutrition. And then finally, on the last slide, one of the big lifts that we did was cover down for the state on the voluntary mapping program, which allowed us to get the contract in place, get a contractor, so that we could really keep a handle on this, so Dr. Rattay and the team could understand what we were looking at as this unfolded throughout the state. It's certainly been a busy year for us. Our soldiers and airmen are motivated, they're excited, and they're really appreciative of the opportunity to be called on by the governor and by our team to come out and help. So that's pretty much all I have. Governor, back to you. Thank you.
Thank you very much, General Berry. Really outstanding work going back, as you mentioned, to last spring. I remember well your support at Delaware Psychiatric Center gave great comfort to both the patients there and to staff. In particular, we had a little bit of an outbreak there, incredibly important at the time. We forget about it these many months later. The school meals that you helped the districts with and delivering when the schools were closed, standing up the alternative care site at Nemours. We didn't need to use it, thank God. We learned a lot through that process, but we were ready, thankfully. And then lastly, importantly, your assistance with testing and vaccinations, critically important. And I think one thing that folks don't know about, obviously you touched on it briefly, is the records management. So incredibly important as you put into our system the folks that were vaccinated and got all their important data so that we could make sure that we know where we are with our equitable guidelines. And so with that, that does it for our presentation. I know we have members of the public, we have the press here. We've got great news this week, a lot of challenges still ahead. Not a time to let down our guard. It is a time, if you haven't been vaccinated, to take the first opportunity you get to get an appointment to be vaccinated. Educate yourself if you're a little bit hesitant. Talk to your friends and family members. Consult the science. I think the science clearly supports the idea of getting vaccinated. We know there are folks that are hesitant to do that, and there will be an opportunity. You can see it. We've already doubled now the throughput over the last month. We're going to have to do the same. Finally, allocation is ramping up. The Johnson & Johnson will start at the beginning of April, and we'll really be able to move through our populations that are coming in 1B essential workers and then on into 1C. So don't forget to continue to wear a mask. I see pretty good compliance. Keep your social distancing, wash your hands, follow the mitigation instructions that we know are working. And one indication of how well they're working, the flu season this year was nothing. And it was nothing because people were wearing masks. And so there was not that transmission of the flu virus through our communities. They've seen that out at Nemours Children's Hospital, where they haven't had nearly the cases that they normally get. And we see it in the records that we're tracking at the Division of Public Health. So with that, we'll let the media have some questions. We appreciate everybody for joining us again today.
All right, first we'll go to Nick Ciolino from Delaware Public Media.
Good afternoon, everyone. For my first question here, I want to go back to the CDC guidance around people who've been vaccinated and public gatherings. I'm wondering if and in what way this guidance is informing the state's decision-making as it looks to potentially roll back restrictions if cases continue to drop and people continue to get vaccinated.
Yeah, so I'll hand it over to Dr. Rattay in a minute, but all this information, this is very new. It just came out the other day. All the information that was presented today goes into our thinking about restrictions within the economy. The focus, again, primarily is in indoor gatherings where social distancing and mask wearing gets to be a challenge, and anywhere where folks, multiple households are gathering. But this is good news for interactions with family members and friends at this level for people who are fully vaccinated. Dr. Rattay?
Yeah, it is a great question. And we know there's a lot of interest in this right now. We know that approximately or a little more than 10% of our population is fully vaccinated at this point, which is really great. But we also know then there's about 90% of our population that is not vaccinated. We are seeing decreases or improvements in our numbers, which is great, but we also are seeing some variants in our population. We know that these variants, both the UK variant and the South African variant, are more contagious. So we're, looking at all of this with caution. We all want to move forward. We all want to be able to decrease restrictions that are in place as soon as possible, but it needs to be done as safe as possible.
And then regarding imposing future lockdowns, a recent study from Christiana Care showed a 34% increase in alcohol withdrawal among its patients following last year's lockdowns. State health officials are also predicting a record year for overdose deaths, and there was also a more than 50% increase in gun violence in the city of Wilmington year over year. While there are multiple other factors to consider, do these data call into question the state's use of lockdowns as a means of promoting public health, and do they inform future decisions to impose lockdowns?
No, I would argue you're trying to make connections that don't exist, and that's a long conversation. We've been working on the street violence in the city of Wilmington for a long time. Could there be issues around stress related to COVID and the lockdowns and children not being in school? The possibility that exists, but we know it's more a function of gang and group activity and beefs that are out there in these communities, and we've got an approach to dealing with that as well. With respect to mental health issues, obviously that's a tremendous concern. You can feel it yourself in terms of anxiety and stress as you're not able to do things, but the idea that somehow we could accomplish what we've seen on the board without these mitigations, nobody that I know in the public health sphere, the scientists would suggest that you could do it a different way or do it without restrictions. So those are obviously consequences that we're going to have to deal with, and consequences of great concern for sure. Dr. Rattay?
Yeah, I mean, I think we all, we would never, ever want to lock down or put any restrictions in place unless there was a public health need to do so to protect people. I mean, the fact that we've lost over 1,400 Delawareans due to this virus is devastating. But all the mitigation strategies that have been in place have certainly had a tremendous impact in decreasing that number of deaths. It would have been much, much higher had we not put these strategies into place. All that being said, we have significant concerns about the mental health impact of this pandemic on individuals. Access to mental health services, substance use disorder services is a concern. And even as restrictions were decreased significantly, the reality is we know that there's still people who have had concerns about getting even just basic healthcare services, afraid to become infected if they go out to access care. So we are certainly concerned about mental health as well as the physical health impacts of this pandemic more broadly than just the infection itself.
And one of the other things that we talk about, one of my biggest concerns is the negative impact on children who haven't been in classrooms for the better part of a year. We know that they haven't received the instruction that they've needed, and we know we're talking to districts and schools, and I know they are talking among themselves about addressing those deficits and making sure our children are where they need to be. And I think the conclusion is it's not going to be something that we can fix in a month or over the summer, but something will be ongoing probably over the next couple of years.
All right, next we'll go to Tim Mastro from Delaware State News.
Good afternoon, everyone. So these declining numbers, really hospitalizations, percent positive rate, I know we're kind of coming down to earth after that surge in the winter, but are we at the point yet where we can attribute any of this to how many vaccinations are out there? Is that having an effect on our overall numbers yet?
Dr. Rattay?
Yeah, I mean, it may be starting to have an impact on the rates, but we did start, all across the nation, began to see decreases late January, February timeframe. So we know that there's some just natural progression of the infection that these cycles go through a peak and then often come down from the peak. So it's hard to say how much you can attribute to vaccine at this point. We know just from our data, we saw a lot less gatherings of people, a lot less parties, a lot less people together in close settings in the January timeframe as well. So, there's a number of factors that led to the decreases that we are seeing, but it is likely that vaccine, as more and more people are getting as more and more people are getting vaccinated, that we just simply are seeing and will continue to see less spread of the infection.
Mm-hmm. And then kind of along the lines of the restrictions, there are some states that are dropping their mask mandates and opening things to 100%. What is just your reaction to that? And what are the numbers that Delaware is going to look at before they make those decisions?
With respect to the states that have dropped their mask mandates, I don't think that makes a lot of sense. It's certainly an ill-informed decision and might reverse some of the gains that have been made. It's certainly not consistent with the guidance of the public health experts, the CDC, the NIH, and we've kind of taken the lead from them from the beginning. We'll continue to do so. Obviously, there's this balance that needs to be struck between restrictions and the strength of the economy, and we'll continue to try to strike that right balance. But to the idea of somehow eliminating the thing that's been determined to be most effective, the mask wearing, a small measure, a mitigation measure to protect with such great a positive impact would be ill-advised.
All right, next we will go to Katie Tabling from Delaware Business Times.
Good afternoon, everybody. I wanted to ask a question about President Biden's announcement, or promise really, that all adult Americans would have access to the vaccine by the end of May. We're still currently vaccinating phase 1B. The health department just informed me that there are 70,000 Delawareans in phase 1C, and that's continuously getting moved back. I think I heard a report that we should expect to roll into that phase by April. So I just wanted to ask, do you think President Biden's promise is feasible for the state of Delaware?
Well, I'd have to do some quick math to make some estimates about whether it's doable, but it certainly is a good goal to have. We know from last summer that with the warmer weather coming, with more outdoor activity, number one, we know outdoor activity is safer, less riskier by a lot. We know that's coming. We saw what happened last winter, and we know that that's very positive. We have seen the supply, the allocation of vaccine coming to our state increasing. It's frankly doubled, more than doubled, I guess, since the Biden administration took over. And so we're the first week in March. I think having that kind of might be a little bit of a stretch, but we're going to do everything we can with the allocation we get from the federal government. Right now, we're not getting, even with the little bit of extra we have because of the delay, the amount that we need to allocate everybody. And if the feds provide the allocation, we'll move it out the door in a fast and fair way. Dr. Rattay, you want to take a shot at that math?
Yeah, I mean, 1B was a large group. We still have a little ways to go in 1B, and we want to make sure that those most vulnerable in 1B, who are our oldest Delawareans, have an opportunity to get vaccinated before we move to 1C. But as we move into 1C, which is a smaller group and beyond, and as our capacity as a state increases, we believe that we can keep up. So if we continue to get more and more vaccine, as the federal government is suggesting, more and more Johnson & Johnson also certainly makes the logistics of this mission easier. We would love to see every Delawarean adult, at least, it won't apply for children, two children, but every Delawarean adult have access by the end of May. That would certainly be a great thing to see in our state.
And part of that depends, again, on hesitancy, right? If you have, the higher percentage of folks that don't want to get vaccinated, that means you'll have fewer to vaccinate. We want that number to be as high as I possibly can. And so that'll affect our ability to deliver as well, along with the allocation that we get from the federal government. Again, the Johnson & Johnson vaccine, if we can get more of that faster, we can hit those numbers faster.
Okay, and this is building off of Tim's question, but when the crisis first started, there was a discussion about focusing on remaining our 7-day positivity rate under 5%. There was also the playbook created by the Pandemic Resurgence Committee about how to handle the resurgence and reopening the economy. Business leaders are now asking me, what exactly will it take to reopen even further? We're at 50% for many of these. I mean, that's kind of the furthest they've gone for an entire year.
Yeah, it's a great question. And it's a question we continue to wrestle with because we try to incorporate new information, including the information that was presented today, not just in terms of the health of the community and our vaccination status, but also the CDC guidance. The CDC guidance has changed pretty dramatically from in the last year, from the early days where they weren't even recommending that you wear a mask till today, where that's the most important mitigation action that one could take. And so we're going to try to factor all of that into it. I know different business sectors that are affected the most, hospitality come to mind, bars, restaurants. We know that indoor congregate settings are the most risky, whether they're churches and worship services or bars and restaurants, when people can't be wearing masks or don't wear masks. And so we'll think about through all of those things and incorporate what we've learned in the last several months. Try to factor in your first question about vaccinations and whether that's having a positive impact. We expect that it will. The question is how. We made, and many restaurants made real progress in lighting up their outdoor spaces. Some can't do that, and that's something that we need to deal with. Others can pretty significantly, and it makes a big difference. Dr. Rattay, any thoughts on that and how we get to a point where we continue to reopen again?
Not much to add. I mean, I think we need to just, we need to look at the incremental steps that we can make forward as more people get vaccinated, as we monitor the status of the variants and our case rates in our population to ensure that we don't get ourselves into another surge situation. We still have relatively high case rates. And so it's just balancing all that information, knowing that we all want to be able to move forward with less restrictions as soon as possible.
All right, next we'll go to Brandon Holbeck with the News Journal.
Good afternoon. First, I just wanted to clarify something with the guidance for vaccinated people. Is it safe to say that's also the CDC guidance is Delaware's guidance. Is there any difference in the message that you're putting forth as far as what vaccinated people should and shouldn't do?
Dr. Rattay?
Yeah, hi, Brandon. We are very happy to adopt the CDC guidance. We certainly looked at it closely, and our team looked at the studies that were used to inform the guidance, and we are in agreement with the CDC guidance.
Great. And my second question for you is, you've said a couple of times that the weather has had an impact on having that number of unused doses increase. But that weather was 3 weeks ago. Is there any reason why it hasn't been able to get out in the week or two following that weather? Are there any other reasons for why there's several thousand doses still unused?
Yeah, well, some of those doses haven't been moved out by some of our partners. Some of that could be a function of ramping up. When I say partners, I mean pharmacies and others. And some of it is just, if you back up 20, 30, 40,000 doses from 1 week into the next, that means that next week to keep up, you've got to double your throughput. And so we did get a little bit of a backup there, which we're going to have to find ways to move those out so that we can kind of catch up with the allocation that we're getting going forward, if that makes sense.
Yeah, and I will add to that. I think part of our one of the things we look at when we look at the data is we go back to see what we had, how much we administered among what was delivered the week before, because in general it takes about a week to, once the time and what you see on our website, when the federal government has begun to ship it, it shows up on our website. So that's even before it's in our warehouse or in our partner's possession. And then often appointments are made. And so it's by the time it actually gets in our Delvac system, that does take about 7 days. But when we go backwards to see what we had 7 days ago, approximately 100% of that was used until we received about 36,000 doses yesterday. So we are getting it turned around. We want to go faster, and we also want more vaccines. So we want to ramp up our capacity even more so. The other aspect of this, really balancing the fast and fair approach is, we could do all, high throughput pods, but then we wouldn't be meeting people in their communities that can be harder to reach. And so we really have to balance all of these factors and make sure that we are addressing the vaccine equity concerns that we have at the same time.
So if you look about distribution and supply allocation, you need there's about a week's worth that's going to be kind of undelivered. What's the term, AJ?
Administered.
Not administered, right?
Allocated.
Like what we have on hand in process, what's in the pipeline, it's usually about a week's worth that's in the pipeline.
So if you look at it now, we've got about a week's supply is about 40,000+, right, AJ? Looking for, and we got almost 2 weeks somewhere in between. So we've got to, because of that delay that we received during the snow, we've got to move some of those vaccines. And one of the reasons too is we're starting to increase the supply to our pharmacy partners and other partners at that level. They haven't ramped up quite as quickly. So we'll probably have to do a larger event to catch up, if that makes sense. AJ, any thoughts on that?
Just the 40,000 is what the state receives to allocate. Last week, there was another 16,000 to 18,000 that went directly to some of those pharmacy programs from the federal government. So just to clarify, there's on the dashboard, both of those are accounted for, put it that way.
And so the pharmacy number, we don't really have anything to do with, right? It goes directly from the feds to those pharmacies. Initially, it was for the nursing homes. More recently, the president himself said it was for the equity objectives through various zip codes. And then last week, he announced that he wanted it to be redirected towards educators. So that's a piece of that number as well. Happy to sit down and go over that number with you, so that if it sounds complicated, and it is.
All right, next we'll go to Amy Cherry from WDEL.
Are you on mute? Amy?
Hi, yep, sorry about that. I actually don't think that I raised my hand. But one question that I do sort of have just ongoing, you mentioned that you're going to be expanding vaccinations to other workers. Is that effort currently underway right now? So are you working directly with grocery store workers, and how will these people start to get vaccinations, and where will they be going?
No, first of all, just about every employer and worker group wants to be on that list. And so there's been a lot of interaction. We've taken a more objective kind of science-based approach towards risk and prioritization. But Dr. Rattay, do you want to talk about how that is occurring?
Yeah, so we've been working on these plans for a number of months, and with some work groups, it's much easier than others. So grocery stores, as an example, has a really an organized group, especially the chains, and have, they're ready to go. They've been ready to go for a while. They have, many of them have pharmacies on site or pharmacies as a part of their entities. And so for grocery stores, it's largely about just getting many of them, especially the larger ones, vaccine. That is the case for poultry as well. Poultry have, many of the sites have occupational health on site, so they just needed vaccine to get started, and they can organize and administer on their own. But then there's some of the other workforce groups that don't have that ability. So they're either being partnered with partners who can vaccinate, or we're also looking at, for those who can't find a vaccination opportunity, a larger event where those folks can get a voucher and come to that event to get vaccinated.
And to restate the obvious, those worker groups that don't have an in-house way of, getting vaccinated become a bigger challenge for us, right? A little bit easier in the sense that the biggest challenge, particularly on the equity side, is getting people registered for an appointment. We can't use the kind of testing approach where you just say you're going to be there at a particular time and keep it open. That just turns into chaos. And so getting folks on the registration list is the biggest challenge for large pods and small community pods as well.
Another question that I had, there's a perception that Delaware isn't moving through the phases as quickly as some neighboring states that have sort of already gotten into 1C. Aside from supply, since states should all be receiving supply based on vaccination and speed of inoculations, what do you think is attributing to that?
Yeah, I don't have a good answer to that, because you're right, it should be proportional. So unless other states have different breakdowns, and they certainly do in senior populations than we do, we have a fairly high senior population, but so does a state like Pennsylvania. My own kind of view is that they're being a little bit loose with it and crossing over more, which we think will create more confusion. Dr. Rattay, do you have any perspective on that?
Yeah, I mean, we've really focused on the 65 plus population, because that's the population that's most likely to have consequences, hospitalization and death. And, we've seen, I've got family members in other states who are in their 80s and can't get a vaccine because it's open so wide. They don't have any idea when they're going to be able to get a vaccine. So for us, we really want to make sure that our seniors have an opportunity for vaccination at least as much as possible before we move on. We don't want them to have to be fighting with a younger, more technologically savvy population to be able to get in line to get their vaccine.
Yeah, and it really is, if you don't have the supply, you don't want that kind of competition, if you will. So clearly has to be the fact that in other states, they've opened it up to the non-senior population, while we've tried to really lean in and get that most vulnerable population vaccinated.
All right, moving on to the pre-submitted press questions. We have time for a few of these. The first one came from Chris Barish at WHYY. He asked, how many of our 1 million population do you estimate will need a vaccine? Minors excluded, how many do you think are in total or eligible?
Yeah, so I'm going to let Dr. Rattay do the math, but my recollection was we have 970,000 Delawareans. I want to say 750,000 or thereabouts that are eligible to be vaccinated. Do the math. The polls suggest that 20% of those are hard-nosed on getting vaccinated. Just think about our school district, a poll they did, as low as 50% wanted to get vaccinated, as high as 85%. So pick a number in between. 20%, I think, is a good number that aren't going to get vaccinated, no matter what you tell them, based on what we see with polling. And so you can do the math there to figure out what that number is. Dr. Rattay, any different approach that you would take on that?
Well, I mean, currently we're in 1B, so 1A plus 1B has well over 350,000 individuals. So we have a pretty large chunk of the Delaware population that is eligible already. We know that children under 16 can't be vaccinated, but among those who can be vaccinated once it's readily available, the guess is, as the governor said, there's probably about 15 to 20% that may be hard-nosed. But what the data are showing us is that, as you begin to roll out vaccine, as more people see their family members, their friends, their coworkers get vaccinated, they become more comfortable in realizing it's safe and side effects are minimal and that there's benefits of it. So, at the end of the day, with the adult population, certainly we hope that we get to, a good 80%. And by the time that we're able to roll it out into to children, and then we'll tackle our younger ones.
And this is the last question we have time for. This is from Susan Canfora at Coastal Point. She asked, concerning those who don't want a vaccine, will they be more likely to catch the virus because the majority of the population is vaccinated, or will the virus be less likely to spread because so many people are vaccinated? Essentially, does mass vaccination weaken the virus or send it more to those who are unprotected?
It sounds like a Dr. Rattay question.
Yeah, it's a really, really great question. It's very different than antibiotics, which, antibiotics, antivirals can sometimes make a virus or a bacteria stronger. What helps this virus mutate is more spread. So anything we can do to decrease the spread means we're going to decrease mutations and we're going to protect people. So herd immunity really is about, the more and more people that get vaccinated in the community, they protect everyone else. And so if you are not willing or not able to get vaccinated, for example, if you're a child right now, but everyone around you is vaccinated, you are protected by those who surround you. You're not at greater risk. So often those vaccinated are in many ways carrying the water or the protection for others.
Okay, I think that was the last question. So let me just thank everybody again for joining us today for our weekly press conference on our Delaware's response to COVID-19. A special thanks to General Berry for being with us today and for the men and women of the Delaware Army and Air National Guard, some of whom are overseas in Kosovo, I know, some of whom are down in Washington, D.C. For the mission at the Capitol. And so many of them are here at home, testing, helping with testing sites, helping with vaccination sites, helping, importantly, it's often missed, with data input and data management. So incredibly important, and who've been so instrumental over the last year in helping our response efforts in our state. And of course, to AJ and his team at DEMA, our partnership with FEMA and the Dover Speedway, and the clinics that we're going to continue to have down there. And especially this weekend, we have 8,000 slots, right, AJ, for educators and for childcare workers. Get signed up. We want to meet the President of the United States' goal of getting those populations done by the end of the month. Dr. Rattay and her team, we're under 100 hospitalizations today, which is a milestone, making progress on vaccinations. Got a long way to go. There is light at the end of the tunnel, and we're going to reach it someday soon. Not tomorrow, not next week, but it's going to be here, and it's going to be a sunny day when it does arrive. So thank you for joining us, and please act with a sense of community, wear your mask, keep socially distanced, follow the restrictions, and let's take advantage of the progress that we've made over the last several months. Thanks for joining.